CRNA nurses were the first anesthesia providers in the country when we first started many years ago, and the surgeons trained them in order to take care of the patients while the patients were undergoing surgical procedures.
So first we're going to start with lighting.
Currently, CRNAs throughout the country are providing about 80% of anesthesia to patients in the rural areas. Here at the University of South Florida, we're training our nurse anesthetists to fill the role of a top-notch, independent anesthesia provider.
I really wanted to join USF because, first of all, the staff is amazing, and also because of the facility, CAMLS, which stands for Center for Advanced Medical Learning and Simulation.
The CAMLS Center is an operating room environment, so we're able to bring the students in and have them get used to the temperature, the sights, the sounds. We have the top level simulating mannequins here, skill stations here. So our students, when we teach them something upstairs in the classroom, we can bring them downstairs and demonstrate it in simulation.
In our nurse anesthesia training, we literally train to the full scope of anesthesia practice, right? So having high fidelity mannequins here is fantastic because we actually get to hear all the sounds, and somebody is in the background controlling the different wants, different needs that that mannequin is portraying to us.
Giving 1 gram of Anacep.
I feel that by them feeling more comfortable, it increases their confidence. They're actually going to decrease patient errors in the clinical setting because they're not learning how to do something for the first time on a patient.
It's the CRNA and the OR nurse and the surgeon and the anesthesia technician and the scrub technician. It's like a dance that you're doing. Everything is orchestrated to keep the patient safe and make sure there's a good outcome.
Our reputation in the community is it's one of the best CRNA programs, the best CRNA program. So I will be looking for a job here locally, and I think just having my degree from this university is going to be a huge benefit.
Great, so let's go ahead and intubate.
We integrate simulation from the very first semester. Our students practice what they're going to do in the simulation environment, so that by the time they step in the clinical environment, our clinical partners and preceptors are just blown away by the level of expertise of our students their very first day in the operating room.
Okay, thank you everybody. We're all finished.